Microneedling radio frequency I do all over the face as an anti-aging, and then I add on the intradermal radio frequency in the eyebrow area and the oral commissures to give a little more volumizing and little blunting of those pores, and also improving the brow laxity out here, which you see the eyelid laxity. So these are the things that I'm going to demonstrate today to you guys. Can I go ahead and a local anesthetic infiltration of the entry point, and then I'm going to use 18 gauge number needle to make an entry point, and then I will do my intradermal radio frequency. I think today is my day of needles, so I will first. Gauze. I'm going to attach the cannula to the yes, subcision radio frequency. Yeah, so before we do that, and they have a 21 gauge cannula. So the advantage of this is the 23 gauge is a lighter cannula. I can go in and do my smaller areas like my brow, the nasolabial folds. But I like to use the 21 gauge honestly for my nasolabial folds and the mentolabial folds because it's more thicker. And sometimes, we all know as we grow older, we see our patients having these adhesions and fibrosis. So I do a little bit of subcision with these cannulas, and then I go and do my radio frequency. That's what I do. Okay, so this one please. I'm going to first measure my cannula till what length I go. I generally stop. I don't go up to the medial edge of the eyebrow. I generally stop to 2/3 area, and because I have a lot of vessels here and I don't want to cause a lot of bruising and trauma out there, so I stop here where my supraorbital tentatively is popping out from there, and then I will go and give a local infiltration here. Tiny prick. Same thing what I'm going to do is I'm going to numb him here. So where my median, I don't have to go the and make an entry point out here. Tiny prick is very comfortable as you can see. So yeah. Now the beauty about this is you have to just infiltrate once and then while I'm injecting, before I start my radio frequency, I'm going to basically do the infiltration. Okay, this is a monopolar radio frequency. So if you can see, we have attached earthing pad to his neck, and so we can show the panel there, focus. Now if you can see the panel of the machine, it has an intensity. It is a continuous mode, so you have to just set the intensity. Okay, you can see how smoothly I'm going in. I'm just going in first, before starting the machine, I'm going to put in a little anesthesia. Feel a little, आपको थोड़ा सा लगेगा. He's very comfortable, and I must say that if men can take this, anybody can. So you can see very gently. There is a linear threading technique that we do here. A little bit of fanning out here. And then also what I do is I keep on tunneling and fanning basically to deliver my radio frequency. The cannula is insulated, only the tip is non-insulated. So that's why it's pretty safe. When I'm doing my procedure, I'm not affecting the other tissues which are in contact with the cannula. Only the tip is delivering my radio frequency energy. So I keep